Hi, and thank you for logging on. I'm here to tell you about the Master of Public Health program at the Jefferson College of Population Health. Today we'll talk about the program briefly, what it would be like if you were a student here, and I'll tell you a little bit about the outcomes and the career journeys of some of our graduates. We'll also take a look at a student profile, and I'll introduce you to some of our faculty. My name is Rosie Frasso. I'm the program director here at the College of Population Health. Here's my contact information. I'm always happy to hear from prospective students. Public health is an important and interdisciplinary field of study and practice with two primary goals. We're in this business to prevent illness, disease, and injury, and to promote and protect human health. In achieving those goals, public health emphasizes social justice, supports human rights, and respects the dignity of individuals and the integrity of communities. These are important constructs in our discipline. The program at Jefferson is accredited by CEEF, the Council on Education of Public Health. Our public health professionals track outbreaks of disease, conduct community health assessments, plan health education programs, direct campaigns to reduce risk factors that foster chronic and poor health outcomes like heart disease or diabetes. We work to advocate for communities, develop policies, and work in both the public and private sector. We're focused on environmental resources and injustices, and we provide access to preventative health services for underserved populations. Many people engaged in public health do research and support multicultural global health initiatives here and abroad. Public health has certainly received a lot of attention lately, and you can see how important our discipline is as you watch the way governments around the world address the COVID pandemic and, of course, issues of racism and poor health. We're here in public health to address these issues head on and make a difference. Public health professionals perform tasks at local, state, and federal governments. They work at community health centers and in hospitals, in non-governmental organizations, at schools and universities, in professional health agencies and insurance companies and businesses. We really are everywhere. We're a discipline that crosses silos. If you come to Jefferson, you'll be required to take some core courses that really highlight public health as a discipline. A course on the foundations of public health addresses the history and the impact of public health on the fields around us. A foundation of the U.S. healthcare system is a course that is really appreciated by many of our students who have been engaging with the health system as either providers or patients for a long time and never really got a chance to understand what it's about. There's also a course on society, behavior, and the environment, a statistics class, a class on epidemiology, which is the study of disease in populations. There's a course on policy and advocacy, a research methods course, and a course on program planning and evaluation. Building programs to improve health outcomes and making sure they work is the focus of that class. Our students also get an opportunity to work in the field. They work in community organizations and health centers, doing the kind of work they may want to do when they graduate, just trying it on and seeing what it's like, and getting firsthand experience in the field of public health. Every student in our program does a capstone, which is basically a master's thesis that you design and focus on an area that you're interested in. At the public health program at Jefferson, there are 4 possible concentrations. After you've taken your core courses, you can focus on public health analytics for those folks that really love the research piece of public health. Healthcare quality and safety, a great choice if you see yourself working in the healthcare space and you want to reduce medical error and improve health outcomes. There's a concentration in public health policy and advocacy. How do we take research and move it into action? Where do laws come from that promote health and well-being? This is a great class for folks that see themselves in the governmental space. And then there's a generalist concentration, and this is for students who want a nimble career, who not 100% sure where they want to land for the rest of their career, but they want strong public health skills to use in a variety of settings. Most of our students choose the generalist track. Some of the courses in each of these concentrations are listed here. Obviously, in the public health analytics track, it's really about research methods, and our students who graduate from this concentration often go on to get a PhD or to work in the health research space. Quality and safety courses are really preparing students to find positions in health systems or insurance companies around the globe. And the policy and advocacy courses give you insight into the environment, into public health law and ethics, and how you apply policy to make change. And then, of course, if you choose the generalist track, you get to pick 6 electives from all those that are offered in the school. At Jefferson, there's many ways to earn your Master of Public Health degree. We're really proud of how flexible we've made our program and how important it is for students to come to this training in a way that works with the rest of their life. So we have many students who are dual degree students. Perhaps they're studying nursing or medicine and they want to integrate public health training into that, or social work. We have students who work full-time and they come to us part-time at night or online to get the coursework they need. We have students who do the program full-time, and we have students who come to us on an accelerated pathway where they spend 1 year doing a 2-year master's. They work really hard in that 1 year, but they take all the same courses as everyone else. And we have a special track for folks who work at Jefferson, who are working full-time on campus and really interested in public health, and an advanced standing program for people who have been working in healthcare, perhaps as a clinician or provider of some sort, and would like to add public health training to their current practice. These are some examples of the dual degree programs we offer: nursing, medicine, law, PA studies, social work. We have a wonderful graduation rate. 93% of our students walk out the door with a diploma, which is quite high, and we're very proud of it. The few that don't, usually it's because they've changed career trajectories and moved into other tracks, which we facilitate and work with them to make happen. In terms of job placement, within 6 months, 99% of our graduates are employed, and we're very proud of that. We have special organizations that we're associated with, and many of our students earn awards at the national and local level, and they're listed here. And many of, here's some employers where our students have landed in recent years. We've got some graduates working at the Federal Emergency Management Agency, FEMA, at the Children's Hospital of Philadelphia doing research work, at Public Health Management Corporation, rolling out programs and interventions to improve health, at our own cancer center and medical center, and at the Philadelphia Department of Public Health. Not a comprehensive list, just a sample of where some of our graduates end up. Some of the jobs in public health, people struggle trying to wrap their head around what you do with this degree. And the reason it can be tricky is you can do so many things with this degree. The salaries range quite a lot based on where you take your training and what you do with it. But this is an example: a program coordinator working at sort of a health system, providing insight and managing work that's done across silos, could earn anywhere between $40,000 and $91,000 a year, and also do work that's rewarding and important and improves health and health outcomes. If you're interested in learning more about public health, we encourage you to look at the American Public Health Association. That's our professional organization, the mothership for most of us in the field. There's a Public Health Learning Network where you can log on and learn about the discipline, and the Society for Public Health Education. All of these organizations have journals that produce research and allow people to understand the discipline and see the many directions public health training can take you. I'd like to introduce you to Beverly Anelli. Beverly is a recent graduate of our program. Well, she's not quite a graduate yet. She's got a few weeks left, but she's an amazing student and scholar. And while she was in the program, she published an op-ed in the Philadelphia Inquirer. She won an essay contest. She's done amazing work in the community and in her clerkship at Philadelphia Fight. And Beverly is a student we're particularly proud of, and she'd be always happy to chat with anyone interested in the program. And I'd also want to introduce you to a couple of my colleagues. There's many, but I only have a chance to highlight a few here. Dr. Russ McIntyre, he does something that students find super interesting. He is an epidemiologist who uses cartographic modeling, or GIS mapping, to understand issues like violence, food insecurity, and how they geographically impact different communities. So using maps to look for patterns of disease or social issues that impact poor outcomes. I love his quote here. He says, "I love the balance of teaching and conducting research. I enjoy working with organizations on research projects and help them strengthen the health in their communities. But my favorite part of my job is teaching bright students in our Master of Public Health program." And Dr. Amy Henderson Riley does some really cool stuff. Her training in public health is enhanced by her interest in health education and health communication. And her subspecialty is called entertainment education. And she works with organizations around the globe to embed health messages into radio programming, TV shows, so to promote health both in a way that's engaging and accessible for people around the globe. And she says the best part of her job is working on those applied projects that really make a difference and allow students to practice the new skills they're learning in the classroom. And this is one of our not so recent alums, Akira. She's been out of the program for about 5 years now, and she does wonderful and important work. She just received our Alumni Award, which is why we decided to highlight her here. She works as a manager on an oncology quality data analyst, she works as a manager of an oncology quality data program in Washington and Baltimore, in the Baltimore area. And she also does important work right out of her organization, making sure that women of color and women who identify as marginalized groups have an opportunity to connect and get mentorship. We're so proud of her mentoring other younger and more junior people in her organization and helping them move up the ranks. Well, I hope it was helpful to get a quick overview of our program. We're very proud of our students and our faculty, and we're always interested and excited to talk to people that would like to learn more about public health. This is an important work, an important discipline, and there's no time more important than now to join the field and help make a difference. I wish you health and safety and social justice for all.